Okay, so today I'm going to talk about the mnemonic. Okay, so mnemonic of the thyroid eye disease. Okay, signs. Several signs are there, and which makes your mind go haywire. So let's talk about them. So thyroid ophthalmopathy is of three grades. Okay, it is mild, it is moderate, and it is severe. Okay, so there's a simple mnemonic. Very smart doctor just married. Okay, so very smart doctor just married. So this is how you remember it. Okay, so let's just see what all this mnemonic is about. So from V, it is von Graffi's. I don't know how to pronounce them, but okay. Von Graffi's sign. Okay, so it is very simple. It is the lid lag sign. Okay, so when the patient tries to sit down, its upper eyelid cannot really cope up with the speed of the eyeball. Okay, so it's like a curtain falls down as soon as the button is pressed. Okay, so here there is a delay. The eyeball goes down, but the upper eyelid is not able to cope up with the speed. Okay, so this is the von Graffi's sign. Okay, okay. So the next is the second is smart, the Stellweg sign. Try to remember it this way: tail wagging. Okay, so there is a continuous wagging of the tail by the dog. Okay, so there is something disruption with this rhythm. Okay, so this continuous rhythm gets disrupted, hence there is infrequent wagging. Okay, so this is known as the Stellweg sign, that is infrequent blinking. So the blinking is not very frequent. Okay, in the Stellweg sign. Okay, and the third is the D, that is the Derimple's sign. Okay, so this is the sign of the Derimple's lid retraction sign. Okay, so simplest way to remember is that Darimple sounds like dimples. Okay, and in dimples there is retraction. There is retraction of the skin. Okay, so there is retraction of the upper eyelid, and therefore it leads to visible upper sclera. The upper sclera is visible. Okay, when you try to look in the eyes of the patient, there is visible upper sclera. Okay, so this is the dimple sign. Now coming to the moderate. Okay, so as I said, it is very simple. The VSD is happen, and there is the J, just married. Okay, so just there is Geoffroy. Okay, Geoffroy's sign. Okay, so there are two ways to remember this. Do you remember Joffrey from the Game of Thrones? Okay, so he was never worried. He was never worried. Okay, he was never worried. So he never frowned. So he never frowned. Okay, so frowning. Okay, here is frowning. Okay, please remember the term frowning. Okay, so the patient does not frown when he looks upwards. Okay, so you ask the patient to look towards the ceiling, and on the forehead there is no wrinkling. The last one is, okay, M, the Mobius sign. Okay, try to remember it like okay, so now we know, like, very smart doctor just married. Okay, so Mobius, it sounds like mobility. Okay, so the extraocular muscles get affected. So once the extraocular muscle get affected due to lymphocytic infiltration, the patient is unable to converge his eyeballs. Okay, convergence. Remember this, not divergence, convergence. So convergence is done by medial recti muscle. Okay, so the patient who looks like a head is not able to look medially towards his nose. Okay, so this is the Mobius sign. Now few signs which are not under this category, but they're very worth mentioning signs. Okay, so the first sign under this is nav zygers sign. Okay, so in this sign, how it is done is the patient is made to sit on a chair. Okay, so this is the patient sitting on the chair. Okay, the doctor stands behind him like here. Okay, and the patient is asked to extend his neck. Okay, the patient extends his neck and he sits like this. Okay, patient sits like this. So Nafziger. So you look on the okay. So this is the face of the patient, and you're looking from behind from the supraorbital ridge. Okay, these are the eyebrows, and you're looking straight ahead. You would see that the eyes are protruding way too much than a normal person. Okay, so this protrusion of the eyes is seen in Nephi-Zyger, Naf-Zyger test or the sign. Okay, so the way to remember is there is a okay, so there is a Z, okay, or the zig. So the patient sits like zigzag. Okay, so here you can see the zigzag happening. Okay, you can see the zigzag happening. Okay, the zigzag happening. So Naf-Zyger zigzag sign. Okay, and the last one which is worth mentioning is the Gifford's sign. Okay, so I'm just it is an honorary mention. Okay, I don't really know the mnemonic of it, but I just know it. So as you know, there are two types of the when the eye is protruded out of the orbit. Okay, so this is the orbit and the eye is protruding out. The two terms are used commonly. Okay, so the two most famous terms are proptosis and exophthalmos. Okay, so proptosis is this condition and exophthalmos is this condition also. But what's the major difference? The major difference is that exophthalmos is used only with respect to thyroid eye disease. Okay, so now you want to differentiate between the proptosis and exophthalmos. So what you'll do, so this is the eye of a patient, okay, who has proptosis, and you want to figure out if it is proptosis or exophthalmos. Okay, so you will just what you'll do is you'll just hold this upper lid and you'll try to retract it. Okay, you'll try to see the superior palpebral conjunctiva. Okay, so when you'll try to see the superior palpebral conjunctiva, you'll be able to see it in proptosis, but you will not be able to see it in exophthalmos. So the reason is when in thyroid eye disease, due to lymphocytic infiltration of a special muscle which is known as Mueller's muscle, you cannot retract the eyelid. The upper eyelid cannot be retracted because of the paralysis of the Mueller's muscle. Okay, so these are some of the most commonly asked signs. Okay, I'm forgetting one of the names of the sign, and the sign is characterized by pigmentation of the lower eyelids. Okay, I'll just write it in the comments. I'm not able to remember it right now. So if you want to see the signs again, so I'll just scroll down on it and you can pause the video and check them out. Okay, So yeah, and I've copied a lot of mnemonics in this video from another video, and I'll give you a link to that. So I thought that video was great video, but it lacked some knowledge. Okay, so that is why I added some stuff from my side to that video. So I'll give you the link in the description to that video. Okay, you can watch that video too. And I just added some stuff from my side to make it more information, like it more full of information. Okay, so I hope you like this video. I hope you understand. I hope you understood stuff. So thank you for watching. Bye bye.